handle of the malleus, which is sometimes what we do when we're doing an under tympanoplasty. In other words, it's going over the malleus but under the annulus. Is that very reliably there's a cartilaginous cap over the short process here. So we'll try and go there and demonstrate it to you. There's usually a fairly reliable cartilaginous cap, which isn't very well formed in this patient. And if you remove it, it might be this tiny little thing here. It breaks you into the perichondrium, which allows you to strip the handle of the malleus. So I normally will get a needle or something and incise from inferior to superior, all the way along the posterior border through the periosteum of the malleus, recognizing that the attachments are superior. And then a sickle knife if we can. And remember, the other thing to remember here is that you can always do this under the microscope. And one thing I like to do with the microscope when I'm doing this particular maneuver is that I like to get my sucker and place it under the medial aspect of the malleus here at the umbo, rest the sucker on the promontory just here, and that minimizes the medial lateral excursion of the malleus. So I actually think this is a better thing to do with the microscope, but just for demonstration purposes we'll do it with the endoscope. And so practice removing the periosteum off the malleus like that. You can see I incised it like this, and you can break through, and you can, it almost folds down like a banana skin. And recognize that if I had the sucker underneath here, there would be a lot less movement here. But when you're doing this in an inflamed ear, it's often a lot easier than in the cadaver. It peels a lot easier. One other point to make when you're stripping the handle of the malleus is that if you don't have a lot of confidence inferiorly that you've removed all of the epithelium, because it's quite adherent as you can see here, then sometimes you need to use a laser to be sure that you've got all the epithelium on. And so you can see that we've lifted and broken into that space in front of the handle of the malleus there. And I've peeled off the periosteum. That's pretty loud, isn't it? I feel like I'm singing them.
I have hearing problems.
At a concert.
That's for
Justin Bieber. The Belushi scissors things?
that or
Here's the straight Belushi.
straight. This one.
Jose Carlos actually has the hardest job in the whole section.
I
They're
can
the
work
cups.
as scrap.
They're the cups, yeah. Just the Belushis.
Shiso.
Which is,
But it's not Belushi, it's
no, it's curved though. It's okay.
squad, yeah.
We can manage. Ideally a straight Belushi, but this will work. And then sometimes you require a sharp dissection off the inferior margin.
This one, yeah.
You got the
Got
straight?
it. Got it. What?
The straight Belushis?
Straight.
Ah, okay.